welcome back to Visions for Health. Today we're going to be discussing acupuncture with Rachel French. Rachel, welcome.
Thank you.
Thanks for being here.
I'm delighted to be here.
So you're a licensed acupuncturist.
Yes.
How did you get there? Was that your first career?
No, well, I guess it technically is my first career, but it wasn't the first thing I thought I was going to do.
What did you think you were going to do?
Oh, I thought I was going to be an actress. Maybe not an actress.
So now you're on TV.
Right, exactly. No, I went for my undergrad in theater arts, had a wonderful time, actually did more things behind the scenes than on stage. But as I was getting to the end of my schooling, I realized there was a next step in there. I didn't really know what it was. At the time, my roommate was an acupuncturist, and I was getting acupuncture all the time, 3-4 times a week, and it was great. And all of a sudden, I was just realizing that I wasn't the same person I was when I started school, when I first, started to think about who I was and what I wanted to do. And I knew I wanted my master's degree, but I didn't want it in theater. And it all just kind of came together at the end of school that all roads and signs pointed to, you need to go get your master's in acupuncture.
So you did that?
Yes.
Do you remember the first time you put a needle in someone?
Yeah, it was myself. And
I hope you did a good job.
Oh, well, no, it was traumatic for me, at least. I had my period, I was emotional, and we were supposed to do spleen 6, which is on the inside of the leg, and it's a major menstrual point. So
To help or to harm?
To help,
okay.
but it's just all of that emotion, and I'm nervous, and I can't figure out how to get the needle in, and I'm weeping on the table.
Not because of the needle?
Not because of the needle, but because I was just an emotional wreck over, I have to now put this needle into my body. And that was kind of a block. I have skin for a reason, so things like that don't happen.
And yet you're an acupuncturist.
Yes, I'm an acupuncturist. Okay. And my teacher just comes over to me, and he looks at me, and he's like, "You're going to have to get over this." Which at the time...
No pressure, though.
Right? At the time, I was horrified, but really it was the best thing anyone could have said to me at the time. I took a deep breath, and I put the pin in my leg, and I was fine. And
the needle went in?
The needle went in, no problem, and I got the chi sensation at the point, which I really needed because I was freaking out. But it was good. Once I got past the trauma of the idea that I had to invade the body, I was far more successful with it.
You just said something that I don't know what it means. You got the chi sensation when you put the needle in. What does that mean? Because let's back up a couple steps.
Sure.
Acupuncture is a really old science. The Chinese invented it? China? Where does it come from?
It comes from China, dates back thousands of years, but it has to be based in Asian philosophy somewhere because it's got roots in Japan and Korea. Okay. And I don't think there was so much sharing between the Chinese and the various other cultures. So I think it was really ingrained in the Asian culture more than anything. Okay. And that did develop over thousands of years.
And what's the philosophy of acupuncture? What does it do? And I don't mean to get into the millions of texts you read about acupuncture, but just what's the purpose of it?
The purpose of it is to return the natural ability to heal oneself to the patient in the most succinct of terms I can come up with.
And what does it, so when you're putting needles in, how do you figure out where to put the needles in?
That goes back to chi sensation. It's a lot of theory, a lot of point location and understanding the nature of the points. But a lot of it is done by touch, observing your patient. What's the complexion like? What are the nail beds like? What's the tongue look like? What's the pulse feel like? And then as you start to say, okay, here's my big ball of information that I have about this person, then you start to select points that should be right for them based on what I have based in theory. Mm-hmm. So I find what's called live point. When you touch a point, it will have sensation, and I'll be able to feel that on the surface, or the patient will be able to feel it in the form of tenderness. And based on what's tender, what I feel, I select the points.
And I remember seeing the acupuncture man with all the lines and all the numbers. What is that? Is like, do the points go in a certain rational fashion? Was it like anatomy? You had to learn the points?
Yes. When we learned the points, we learned the points. All of the points are based on distances that are created based on the individual. So what's called one sun is the width of a knuckle. My knuckle is different than your knuckle, is different than someone else's knuckle. And we use the knuckles to determine, okay, it's 3 sun away from this point.
Of your knuckles, though, or
of the patient's knuckles.
Okay.
So you're averaging, if you're working, if I'm working with somebody who's, 6'6" and 200 pounds, I know that what would be, 3 sun is actually 4, all 4 knuckles.
Does it matter if someone's overweight or ideal?
No, not really, because actually the hands are one of the few things, they may swell, but you don't necessarily have, what's the word I'm looking for?
Doesn't change your body per se. Okay,
right.
Interesting. All right. So there's these points, and are they in any rational fashion, or is it like...
Definitely rational fashion. They are located over what we call meridians, and the meridians are like waterways. They travel from your fingertips into your internal organs and out again to your legs. They don't necessarily go, one meridian may start here, but another may start here, but it's always going to the fingertips and to the toes. They do reach the head and the neck, and you can find them in the grooves of the body usually.
This is way beyond most, like I'm thinking the grooves.
Oh, sorry. Well, it's where the muscles meet, I should say. I'm sorry.
Okay.
That wasn't...
so where things come together.
Yeah, exactly.
All right.
That makes more sense. Sorry.
And does it hurt?
Not if you do it right. I mean, sometimes it pinches when a pin goes in. But on the whole, I always tell my patients, it shouldn't be sharp, it shouldn't be stabbing, it shouldn't be burning. If you feel those things, we need to adjust something. Something's wrong. Okay. There is a dull, achy, heavy sensation that you get, and that's the chi sensation I was talking about. That's how you know the point is moving and it's alive and awake.
And what's the purpose of doing that? What would putting a needle in that point do?
It creates an awareness in the body. So with spleen 6, which is down here on the ankle, there's a very strong connection all the way into the internal organs. It reaches the digestive system. It has a very strong connection to the other internal organs. And when you create that signal, it's like turning on a light, maybe, so that you can call awareness somewhere else in the body. Like, okay, now it's no longer dark down here and I can see all the way down that tunnel.
So it's unblocking?
Thank you. Yes.
Like opening up the sight lines? Or
yes.
So the meridians are basically these lines and you want them to be free-flowing?
Yes.
Okay.
Beautiful.
So when you're putting a needle in one particular point, it's because there's a blockage in the line?
Yes.
Even though, so you could put a needle in someone's ankle and it helps their digestion?
Absolutely.
This is very weird for like Americans to think about, I think. Because it's, in order to improve my digestion, I have to take a pill.
Right. Right. Well, and because we've lost that connection, usually what happens is we're sick for so long, we start to disassociate from the body, and because it's painful and I don't want to be here, or if it's painful, I'll go somewhere else and my body will experience it, but that's okay because I'm somewhere else. And we need to bring the awareness, the mind, back into the body so we can say, okay, why is there pain? Well, pain is stagnation from a Chinese perspective. Things aren't moving. If things are moving, it doesn't really hurt.
Okay. So what's acupuncture good for?
Lots of things. The nice thing
Is there anything it's not good for?
Oh my goodness. I have a tough time treating tinnitus, but I know others who have
ringing
success
in the
with
ears?
it. Yes.
Okay.
So there are things that...
Is it good for pain?
Yeah, of course. It's
Seems
good,
like
definitely.
weird, like you stick a needle in and that would cause pain, but it's good for pain. No?
The idea being that if there's a block somewhere, you want to bring the awareness to that area so you can start to move it. And this is what I meant when I said that it enables an individual, it reactivates the body's ability to heal itself. Because what you're doing is, once you bring your own awareness back to your body and you start to understand how things are moving in it, you can start to connect with yourself and say, oh, I'm getting that headache. Why am I getting that headache? Oh, I didn't drink enough water. I'll go drink some water and I'll feel better and I won't get that headache. As your awareness is in your body, you're able to understand why you're reacting the way you are to different situations.
So there's like 60 different things I want to ask you. So what's a typical visit?
Typical visit, no matter what you're coming in for, whether it's knee pain to digestive issues, we sit down, we have a full discussion about your entire self, whether, do you have chest pain? Do you get headaches? How is the digestion? Do you have pain anywhere in particular? Because all of these things are an amalgam of what's going on in your body, which is, for all intents and purposes, from a Chinese perspective, like a weather report. It's very...
it's your barometer, right?
Yeah, exactly. That's how you know what's going on. If you're waking up and your eye is always twitching, there's a little bit of wind in there.
All right, so they come in, down. You talk.
Yes, we talk.
And then what happens?
And then I look at the tongue and I make some scribbles on my paper. And then I take the pulse and I make more scribbles. And by that time, I have a really good idea of what's going on. At least the loudest thing that's going on will be really clear in that first session.
Okay.
And I'll pick my points. And
do I sit do you sit? Do you lie down? Do you stand?
I don't make people stand. That'd be uncomfortable. Typically what happens is somebody will lie face up, unless they have back pain that I specifically want to target, and they'll lay face down. Unless somebody's really uncomfortable, they'll be laying down. Okay. I might have somebody seated if there were extreme limitations in mobility.
Okay.
And then I swab the points and...
With what?
Alcohol, rubbing alcohol.
So you clean the skin?
I clean the skin.
Okay.
All of the needles are single-use, disposable, sterile.
So you haven't used them on someone else?
No.
And open them for me?
Yes.
Okay.
And even a needle that's come out of your body will never go back into your body.
Oh, okay.
So it's a very clean setup. Mm-hmm. Then I'll palpate for the points, again, based on what I think should happen. I'll go around and I'll check what's alive, what's ready to be worked on. And very gently, if somebody's very nervous, I'll work with them. I'll have them take deep breaths, and I'll insert the needle with their breathing. And that's it. Once the pins are in, we adjust them a little bit here and there. If there's
and they lie there.
And they lie there.
Okay. I'm assuming that every person's different in terms of
Absolutely.
How long the needles stay in. And okay,
Yep.
So that varies for people. How long is a typical treatment time?
The first treatment lasts 90 minutes, typically, since we have to talk, and then follow-ups are 60 minutes.
Got it. All right. What is your favorite acupuncture type patient?
Oh my goodness.
Like, what's so if acupuncture could work for everything, what do you love?
What do I love to treat? I love working with people with emotional unrest because it's actually really easy to treat. I think people always think like acupuncture is for pain or digestive stuff is sort of coming into the picture, but the fact that I have a lot of patients who are dealing with a lot of anger during the menstrual cycle. And people think like, oh, I have PMS and that's just the way it is. Yep. And they don't realize that they don't have to live like that. Nobody has to, want to strangle their husband and, lock the kids in their bedrooms for, a week.
So does acupuncture promise to make you fall in love with your husband or just not want to strangle him?
Bring your husband in too. You guys can both fall in love again if that's what's necessary.
So it works well with emotional. What about anxiety or depression? Is it also?
Absolutely. Works really well for anxiety and depression. Also ADD, ADHD, people who are hyperactive can't find it within themselves to sit still for 30 seconds. Mm-hmm. A lot of past traumas. It can be good for helping people to be willing to even face that, to begin the healing from whatever's happened to them. So there's the ability to really because the emotions have such a strong impact on the body, I think the best example is, you're all frustrated and you get a stomach ache. I think a lot of people with IBS might be able to relate to that. And once you realize that the emotions have a big impact on the way you're physically feeling, if you can unknot the emotions, a lot of the physicality that's surrounding them is going to resolve itself.
So you work with people on what's happening in their bodies.
Yes.
What about menopause? Is it good for menopausal issues? Is it good for nobody likes to really talk about the women's stuff, but is it good for irregular bleeding? Is it good for painful periods?
Absolutely.
It can. How often? So then everybody's different, right?
Everybody is different. I mean, you have people who don't have periods at all and need help actually, they may have a period every 120 days and they need help creating regularity out of their cycle versus, someone in menopause who is experiencing hot flashes. And all of these things are often hormonal imbalances, and the body is really smart. The body knows how to make everything that it makes, so you just have to remind it.
So you're working with people's bodies on optimizing their function.
Yes.
How often do people have, if a woman has hot flashes, how often do you tell her to come?
I want to see her every day for a week until she's 7 days.
Every day for a week?
Excuse me. Every week.
Oh,
until
every week.
She's,
okay.
Sorry. Every week until she's 7 days without hot flashes. And once she's 7 days without hot flashes, we know we're somewhere.
Okay.
And then we taper down from there.
Okay.
Oh my God. Every day for a week.
Well, I was wondering if you made house calls, you go to people's houses, you work all the time.
Right? No sleep. No, that's not. I'm sorry, misspoke.
Do you treat your friends and family?
I do. I treat my mom right now.
You do?
Yes, I do.
Was that weird to stick a needle in your mom? Or was it the moment she lies down?
I've been wanting to treat my mom for a while. So it was good. It was the right thing. And, that was okay. When I started treating my mom, I was definitely at a point where I was comfortable in my own skill level to say, oh, no, you just be calm on the table. It's okay.
Right.
We'll do this. It'll be okay.
Do you treat other family members?
I do. I've treated my dad, and we've worked on his shoulder. He's, all about the musculoskeletal stuff, and that's awesome. My sister called me the other day. She says, I'm going to California in a couple of weeks. Bring your needles. You got to treat Ronan so you can fix his knee. It's my brother-in-law. So, yeah, it winds up turning into, and that was one of the reasons I wanted to get into this, so that I could help my family, because it helped me so much.
Right, you were doing it when you were in college, because your roommate did it.
Exactly.
I was going to ask you something. What about people who are scared of needles?
I work with a lot of people who are scared of needles, including my mom and dad. So I try and just let people know that it's not the same experience that they're expecting it to be. When you go to have blood drawn, it can feel very invasive. They're trying to puncture a vein, an artery, a vein. And that changes the pressure in your body, and that can be extremely uncomfortable. But it doesn't have to be like that. And I really work with people from just talking them through with their breathing to checking in once a pin is in. How are you feeling? Are you okay with this? If it's too much sensation, sometimes you get a lot of chi sensation, and it's a good thing because it's very moving, but it can be overwhelming.
Do you work up to it with people who are scared of needles?
Absolutely.
There's something called acupressure.
Yes.
Do you also do that?
Not typically. If you're coming in for treatment, I may massage the points before I pin, but you're coming in for acupuncture, and that's okay because that's you saying, I'm ready for this change.
Got it.
And I've never had somebody say, no, I'm so scared I can't have you put that pin in.
Okay. So they sort of self-select. They don't come in the door.
Exactly. If they're really not willing to have a pin, they won't come in the door. Yeah.
And you say pin, you don't mean like when your hip gets pinned when you break it.
No, I mean like teeny tiny, no bigger than a human hair.
Like I forgot to ask you to bring needles actually, so we could demonstrate them. But so they're thin, they're little,
very small, literally the width of a human hair, 0.18 millimeters.
That's little.
It's really tiny.
I mean, I know that my finger is 10 millimeters, so 0.18 millimeter is can't really get my head around the math of that one.
It's
little.
smaller than a sewing needle. You can fit about 3 to 5 inside the type of needle that you would have blood drawn from.
So it's really little.
Really tiny.
Okay. And is there anything acupuncture doesn't work for that you say, okay, you said tinnitus. Anything else? Like basically if people are complaining, what about energy? Is it good for energy?
It's one of the easier things to treat. If you're just feeling a little fatigued, it's usually pretty easy in a couple of treatments to get you feeling like back on your feet and ready to go again.
Do you work with other modalities? So do you work in tandem with nutrition or lifestyle or any other types of treatments?
I do, definitely. Nutrition is huge. I love that we have such a great family of nutritionists at Visions, because then I don't worry about telling people, you need to cut this out, you need to cut that out. That's somebody else's job.
Right.
And also we have great folks for emotional support, whether it be spiritual guidance or counseling. There are so many different veins of talk therapy.
So you do incorporate, like, will you say to someone, I think you probably would benefit from a consultation with
Yes.
nutrition or a psychiatrist or something?
A lot of the time when I'm dealing with pain patients, as we're getting towards the end of the pain cycle, I think of the yoga therapist. You can start to think preventatively.
Right.
If learn your stretching, learn how you're supposed to move, and then you're not going to see this recurrent shoulder injury. You'll be able to it's all about self-care.
That's really interesting. I never really thought about how to work with different modalities. So, because you don't do massage, right?
No, I don't do massage.
Okay.
But massage is very important, especially when you're working with somebody who's in pain.
Right.
I can reach the deep tissue to get a muscle out of spasm, but if there's a great deal of knots or tension still, a massage is going to do a world of good.
So you also work with patients who are pain patients?
Yes.
And you can help them?
Yeah, definitely. Definitely. I have sciatic pain is a personal favorite, just because it responds really well to acupuncture. Usually you just need to get the muscle out of spasm and boom, somebody can walk again. Also, what was I going to say? Pain. I was just thinking.
Pregnant women? Like pregnant women who always have back pain?
Yes.
Works for them?
Typically, yes. Not necessarily a group of folks that I'm used to treating. Once people are pregnant, I usually say, "This is wonderful! Congratulations! Call me in your 3rd trimester."
Got it. What about nausea of pregnancy? Is that something?
Yeah, that's definitely something that you can treat. But you have to, somebody's pregnant. It's a very delicate system.
Don't mess with it?
Don't mess with it unless it needs to be messed with.
What about infertility?
I prefer to talk about fertility.
Haha, nice. So you can work with patients on fertility?
Absolutely. Again, because a lot of fertility issues are just the hormones aren't quite balanced right. The cycle isn't happening the way it needs to happen. So once you get the menstrual cycle to be a cycle and the body is responding correctly, fertility happens very naturally and easily.
Do you treat both members of the couple, or do you only treat the woman or the...
It depends on what the couple is open for. And it depends on how severe, if you're dealing with amenorrhea, the first thing you need to do is get the period started and then see if you can even get pregnant, and go from there. If there is an emotional disconnect between the couple, it's actually, it can be very heartbreaking when somebody comes in and says, we want to have a baby, and you start talking, and all of a sudden you find the relationship they're not syncing up with their partner.
Right.
And so that can be a time when you really want to bring the partner in and have them treated together.
So if there's an emotional disconnect, you'll bring them both in. If it's truly physical, you'll bring the person in who is, so low sperm. Do you treat the man for that? Or, you can't treat the woman.
Oh, yeah, definitely. Okay. Men come in for fertility purposes as well.
Okay.
And you can help improve the motility, and you can help improve the energy of the individual, because it's considered, you don't want to hear me go into major esoteric details.
I don't know about details, but it sounds like maybe the sperm are a barometer for how's the system balanced.
Exactly.
So if the system's out of balance, you can work on getting it back into balance, and then you'll know that you've done a good job because Things are working downstream.
Exactly.
Or swimming upstream, whatever we want to call it. Okay.
Yes.
All right. We have limited time left. Is there anything else you would want to talk about?
Oh, it's good for ADD too.
We didn't talk about that. Kids?
Kids.
Do you treat kids?
I do. I treat, I've treated, it usually tends to be, 8 years old and up, but I've definitely treated babies.
With needles?
No, not
No.
infants. Infants don't get needles.
Infants get...
I mean, my 2-year-old, or when she was 1.5, she got needles for teething, and it works beautifully. But we're talking about ADD for the next 30 seconds. And it's wonderful. I've seen kids go from not being able to focus, getting C's in science class, and, smart child just can't sit still in class, can't do the homework. And after regular treatments, there's no medication, and the kid's focused, and they're able to recognize, where they need to support themselves to get through whatever's driving them nuts, whether it's the classroom setting, the homework, the teacher.
You just talked about a huge topic here.
Sorry.
We'll have you back. We'll talk about that again.
Sounds good.
Thank you for joining us. This is an episode of Visions for Health. I'm here with Rachel French, who's a licensed acupuncturist at Visions Healthcare.